You are listening to Medicine and the Machine with Medscape Editor-in-Chief Eric Topol and Master Storyteller and Clinician Abraham Verghese as they talk with experts around the globe about the hottest topics in healthcare. This podcast is intended for U.S. healthcare professionals only.
Well, Eric, here we are, another year of Medicine and the Machine. And for a change, it's going to be just the two of us sort of catching up and digesting, I suppose, all the extraordinary people we met this year and all the events of the year. What a pleasure, though.
Yeah, we've been through a lot, as everyone has who's been listening here. We've been very lucky to speak with so many experts, transdisciplinary, virologists, immunologists, epidemiologists, I mean, you name it. Plus, obviously the clinician's point of view and pediatricians, I mean, quite a gamut of people. So I think it's been helpful for us to learn from others about the toll of the pandemic, along with where we're heading.
Yeah, I don't know about you, but I remember this time last year, I was fortunate to get the vaccine about December of last year, at the tail end of December, maybe it was early January. And I remember thinking, and I think this has really been the problem the whole year, that now we're out of the woods.
Right.
And in a sense, we were out of the woods, but not quite. And we underestimated how difficult it was going to be to get the vaccine to people or to get them to take it. And so the whole year has sort of gone by, and I have a sense of being cheated in some way, as though the outcome of the movie wasn't what I thought it would be.
I couldn't agree with you more there. When I got the first shot in December, I thought, this is phenomenal, because we knew about its 95% efficacy of both the mRNA vaccines, which was of historic note because so few vaccines have gotten to that level of efficacy, no less that quickly to be produced and tested and validated. So, I thought, wow, we're gonna conquer this. I think we would have if we had been able to contain the virus globally quickly. Had we never gotten to Delta and we just stopped, at the alpha phase of the variant, we had it. I mean, I think we would have nailed this and gone to an exit ramp and gone to, this low level of containment. But instead, unfortunately, we have moved on to these, with Omicron, really would be viewed as the most challenging of all, just because of its just remarkable growth, doubling advantage and immune escape. I really didn't anticipate we would be going into 2022 in this situation. I actually thought, I guess I'm too much of an optimist, Abraham. I don't know what you think.
Yeah, I'm an optimist too. And I must say, it's funny because I was looking at your Twitter feed today, and you're mentioning the two-drug combination that may well hold great promise. And I'd love you to talk about that. I know we're leapfrogging over the whole year, but or are we guilty of the same hubris that we had about the vaccine with this two-drug combo?
Yeah, that's a very good point, because with the vaccine trials, we had, between the Pfizer and Moderna, we had some 75,000 people tested, and you had a real readout before the first dose given of a vaccine to a person December 14th of 2020. Here we have two what would be considered small trials, a high-risk trial and a what's so-called standard or really low-risk trial. And the results, if you just look at it from a standpoint of efficacy for a pill to be taken for 5 days and squash the need for hospitalization or death by 89% for the high risk and 70% for the low risk, it's pretty remarkable. But we're talking about a few thousand people, not 75,000 people. So even though with Paxlovid, the trials are much smaller, we're talking about a few thousand instead of tens of thousands, the results are pretty striking. Remember, this is a two-drug combo. The Paxlovid is the active drug. The ritonavir is just basically to add to the half-life of the Paxlovid. But to see 89% reduction, an absolute 7 per 100 for deaths and hospitalization, that is 0 deaths in the active treatment arm for high risk. And also, in the low risk group, these are people with breakthrough infections and really no other real major risk factors. They had a 70% reduction. So this is very different than the Merck pill. This is a pill that has action against Omicron, so it doesn't really get buggered up by variants. It's taken down the main protease, so it basically puts an arrest to replication of the virus. So if you want to simplify it, it kind of stops Omicron or coronavirus in its tracks early if it's taken in the first 3 or even 5 days. So this looks great. The only problem is that we're only going to have 10 or 20 million treatment courses of these blister packs, these 5-day pills, and that's not going to hold us with the way it looks right now for Omicron's ascent in the US. So it's good. We need it. But its validation isn't anything like what we got with the vaccine trials. And it isn't really preventive like vaccines. It's really when, the horse is out of the barn, when there's an infection. And that's a different way to approach and try to tackle, especially Omicron.
Yeah, when I'm hopeful that it'll make a difference, but clearly it's going to be along with many other things, including masking and vaccines and boosters and so on. I thought it was very interesting yesterday when we spoke with Andy Slavitt, how he characterized it, which was a helpful thing for me, that only 14% of the country is effectively vaccinated if you count booster doses. And I think that's a very nice way of thinking about it, because we have false assurance from 2 doses, which are as good as nothing, it would appear like at this moment.
Yeah, I mean, if you look at the neutralization studies, and there's so many of them now, more than a dozen, you see such a dramatic drop off in the ability to neutralize the virus with Omicron. 2 doses just doesn't cut it. And you see efficacy that gets down in the 20% level for protecting against infection, symptomatic infection. So yeah, I agree. We're at a very low rate. Our waning every day is in excess of our new vaccine. So we're going in the wrong direction. Instead of being at 60%, we're dropping down. And I think you are well aware, Abraham, we're already ranked 65th or somewhere along the country list, which is unfathomable if you think that we had the vaccines, the ingenious work that was done to get there and to get them through the clinical trials. This was a US effort, and here we are failing in many respects. It's depressing, don't you think?
It is depressing. In fact, when I was looking back at the list of people we had over the course of the year, actually over 2 years, we've had some really colorful, interesting people, everyone from Robin Cook to Walter Isaacson, but we've had a lot of, scientific experts, and we always seem to come to this place where, there's the science and then there's a human behavioral side, and it strikes me that we haven't yet brought our best science to understanding human beings and how they operate, and figuring out how to overcome all the very things that are making us 67th or 69th in the world in vaccine rate. I think it's more complicated than political loyalties. It's about human behavior, and I think we somehow have to dig even deeper.
I couldn't agree with you more. I have had new respect for the importance of behavioral science, just because who would have ever predicted, if you have a common enemy of a formidable virus, that instead of uniting against it, we would just be trying to go after each other with this. I mean, it does seem to me largely politically motivated, but obviously there's also the anti-science, anti-vax, and the movements that are the conspiracy theories and all that. So we have 2 issues here that have impeded our ability. And here you have the science that's actually been formidable, the amount of progress in this compressed period of time. We could have gone the typical 8 years before we had a vaccine.
I know, yeah.
Or we could have gone without ever having a vaccine. I mean, that's what's amazing.
You've done a good job of listing the sort of scientific milestones, and there were so many of them early on. And I mean, they continue. But maybe it would be helpful to just have a recap of where science has brought us from the moment this virus came on the scene.
Yeah, well, I think a lot of people weren't so aware of the importance of sequencing the pathogen. If there's one thing we learned about genomics in the course of the pandemic, it's that when you sequence the pathogen along the way, you can follow basically its footprints. So many of those 30,000 letters of the coronavirus change, and you can tell spatiotemporally where it is coming from. You could even trace a super spreader, who is patient zero. But most importantly, you can trace the appearance of what is potentially a very serious variant, or in the case of the original Wuhan ancestral wild type virus, that was the one that led to the template of a vaccine within days. I remember how exhilarating it was to talk to Tony Fauci about how within days of that Saturday sequence downloaded from the site, the virology site from the Chinese scientists, how they were able to turn it around and hand it over to Moderna to get the vaccine made, to get into the study. So sequencing the virus has been a big one. And I think worldwide, we've seen, of course, that's how the South Africans could warn us about Omicron from their great science. And they've been leaders in this, no less the UK, the consortium there that's been, exemplary. The vaccine, obviously, the very rapid appearance of monoclonal antibodies was a big one. And that's been a disappointing story too, because, they really worked, but we couldn't get our act together to give them to people. Except when, certain places like in Florida where they were using them in place of vaccines, which was absurd. But, we had people who lives have been saved perhaps, or, very, very ill that could have been stopped earlier in the progress, but we couldn't get these infusion centers going. And now almost all these antibodies don't work against Omicron, as we're learning in recent days. So that, I think, was great advances quickly, but a disappointment of how we weren't able to adjust in our healthcare, which is not, starting a new IV drug, in the midst of a pandemic. That's where it turned out to prove to be quite tough. That's why I think the pill is, be, much more important. Other science, though, the immunology, we've all learned a lot about immunology. It's been amazing about not just the neutralizing antibodies, and also about the whole memory B and T cell story, and the intricacies of that immune response, whether it's from infection that sees the whole virus and it basically mounts a response to everything, versus the spike protein, very more specific type of immunity one gets and derives from vaccination. So, I think that's been a really interesting thing. One other area that I know both Stanford and Scripps is really strong in is structural biology. And where I think a lot of the folks at Medscape don't have a real appreciation for that. But the ability that we can now have a 3D model of the virus, of all of its binding sites, and the antibodies that bind it, no less the T cells that bind the virus, puts us in an incredible power position to be able to predict what's going to happen, and ultimately develop a pan-coronavirus vaccine, which we need pretty desperately. So that is an area where, that's blossomed during the course of the pandemic, and our vaccines benefited because the introduction of this 2 prolines in the messenger RNA led to markedly higher levels of antibody production, and that was a human engineered spike protein that led to that, which was a structural biology triumph. So anyway, there's a lot of parts of the science that have been surprisingly vital to the progress we made, but the gap and the behavior, as you said, Abraham, that's what's holding us back.
Talking about behavior, or actually talking about humans and humanism and human beings, I think what has struck me this last year is the level of fatigue on the frontline healthcare workers. I'm talking especially about my residents. I mean, it used to be that, we were the heroes for our residents, but honestly, the residents are my heroes now. I mean, they've gone almost 2 years continually masked. Their social life, which at their age is a critical part of their well-being, completely disrupted by this vaccine. Tremendously overworked. I mean, if I go by what's happening in my hospital, and I think it's representative, just all comers, all admissions for all reasons are just up, and people are tired and they're stressed and they're waiting for a break. And, I do a lot of sort of individual counseling ad hoc where people just show up in my office, and I keep sensing that people are under a lot of strain, and a lot of them are rethinking everything. And, I sometimes wonder what that's going to mean for the workforce. I think house staff, and I'm actually on their side for this, should organize and need to organize better to protect their best interests. Some of our hierarchical ways of doing things, I think, are getting outmoded, because the fact is, these are frontline workers. There are trainees, but they're also frontline workers, and they need that kind of respect and attention. But I also think, we've done a lot for physician wellness in the last few years, but it's never been more acutely needed than at this moment.
I think you're bringing up a vital point here, Abraham, because before the pandemic started, we already had a global crisis of burnout and depression. And then superimposed on this, we've had the stress of the pandemic where all clinicians were put at risk. And, this has been just the day in a life of a clinician, to be just having an N95 mask on all day, where you feel like you can't breathe, no less that you could get COVID from a patient, and all the other stresses involved, as you alluded to. This has been tough. I mean, in one way, you see a lot of physicians, young people rallying, that the noble cause has brought out the spirit, but on the other, it's so taxing and stressful. So again, here we are looking at, with the Omicron story, a whole new chapter of stress on the medical system, one that didn't support physicians and nurses in the beginning by not having protective equipment gear, that didn't have the testing ready, that basically patients were coming into hospitals with COVID and there was no ability to even diagnose they had it. And you know what? What's amazing too is here we are 2 years later and the testing still sucks. I mean, really, you would think that every healthcare worker would be able to do a rapid test every day and have the results in a few minutes, so that they know when they came to work that they were in good shape, especially with all the waning we know of immunity. So we just aren't getting it right, and we're not, prioritizing. It was great to see the healthcare workers get the first tier of the vaccination. That's great, but so many other things have missed our workforce. The other thing I'm surprised about regarding our workforce is how it isn't compulsory to have vaccination, and how the courts have not even held that up. I mean, what do we need here to show that we're the model and the latest study showed that only 70% of the healthcare workforce across the country is vaccinated. Isn't that hard to believe?
That's shocking to me. I mean, we're at 90 something plus. I'm sure you are, but you're right. Overall, it's much less. It is shocking.
Yeah.
The other thing that surprises me, Eric, is that, we have hospitals that are overburdened, and the disconnect between a governor from time to time sensing that they have a responsibility to the hospital and to the people who work there, statements that they make, and, could just overload a hospital when that could be avoided. And I just feel like there needs to be a stronger connect between, governance at a political level and hospital welfare. That should matter. I mean, you really should not be able to hold yourself proudly if you're overburdening your hospitals and flying in the National Guard for something that you could have prevented.
Right.
I mean, I don't quite know what the answer is, but it's been an interesting year, and we all have to dig deep and find the resilience and the resources for the year ahead. So let me ask you personally, how are you doing, and how have you weathered this year and the year before, and how are you different?
Well, I think, for me, it's been trying to get into the science and the moving parts to just keep my head down and use it almost like a therapy to deal with it, because it's so consuming, and in many respects, the disappointment can be overridden by just trying to get, trying to analyze what's going on and, where we can go. Trying to suggest, one of the things that I feel lucky is, being able to have had a chance to get to help deal with some of the folks setting healthcare policy, whether it was the FDA commissioner or trying to work on the CDC or the folks at the White House or NIH, whatever, in some of the things that we've needed. Obviously, we haven't had many of those things get actualized, but it's been a privilege to be able to interact and to have some of the outgrowths of our discussions, whether it was between us or whether our guests, to help to bring that to light to some of the key leaders in our government or in our science community. But otherwise, I feel privileged to have stayed healthy because I done everything I could. I basically hid in a cave except for going into clinic, and haven't had inpatient services during this time because I'm an old dog and probably not very wise for me to be doing that, especially just thinking when we're ready to go back and knowing that it was going to be, another surge now. But the clinic has been the one saving grace for me. I thoroughly enjoy it. And the connecting with patients, I missed it terribly when I was just doing teleconsult. And so that for me is the best day of the week I have. And the other thing I just would say is we're lucky. Our whole family, our 2 kids and the grandchildren, are all here locally. So we've been able to maintain a social bubble to be able to stay together. And again, very fortunate, because look at all the families that have been split apart throughout this time, rarely or maybe not even having seen their family members because of the duress. So overall, I look at it feeling quite lucky. I don't know. What do you think?
Yeah, I have the same sense of enormous good fortune to be able to sit in a warm house with food in the fridge and access to healthcare when I need it. And I think this whole year has made me much more acutely aware of just how lucky I am. I think the virus has done a really strange thing where it sort of ripped the cover off things that always mattered to me as an immigrant, coming into almost a two-tiered medical system where you're shunted into the inner city hospitals when you first arrive as an immigrant physician, and yet America needs thousands of those immigrant physicians every year to man the inner city hospitals. So all the wonderful discussions we've had on race and all the wonderful guests we've had talking about that has felt like something of a vindication that these topics have become mainstream and we're able to tackle that. I think while you've turned to science, personally, I've often turned to literature. So I found myself going on a Dostoevsky kick, making up for my lack of a liberal education, and did a lot of reading Saul Bellows. I've just been reading quite a bit. I get to attend on the wards, but not as often as the hospitalist crew, although I function pretty much as one. But I'm starting on Saturday through Christmas, I'll be on the wards, and I guess I couldn't have timed it for a better time. So we'll see. But I mean, I kind of, I'm looking forward to that because, as I said, I don't do it half as much as my younger colleagues, and there's a lot of walking involved, a lot of standing, and I think we're close to the same age, and it's physically harder than it ever was, I think. So it feels, but overall, I think all of us are addressing the meaning of our lives in a way that we might not have quite as much, but for this strange period in human history. It's important to stay optimistic. There's a lot to get discouraged about, but honestly, the privilege of doing this show with you has been a beacon in this year. Always something to look forward to, and I hope we continue on the same vein, but with much better news next year. Happy things to talk about.
I hope so, and I always have the confidence that we will get there. We will get through this. I think 2 years is enough, more than enough, maybe about 2 years too long, but hopefully there'll be in the months ahead, the real sense of an exit ramp that, we can get to a level of containment and move on with our lives without the fear, even if it means, having to have more attention to masking in certain circumstances and better air filtration and ventilation standards and things that we should have attended to before we got into this mess of sorts. But I do think we have enough of our tools in the armamentarium that we will get through it, and it's just a matter of when. And then we can, hopefully look back at this years from now and say, wow, well, what a tough period. And we were lucky to be those who got through it. We learned so much. And, it's likely that we will face something like this again, perhaps with a different virus, perhaps with a different pathogen even. But surely that we will do better, particularly in the United States, which should be a leader. And that's, I think, will be great, is that we'll continue to have these discussions with people who will give us insights about the whole, I think, wide angle lens, everything from, as you say, our own demographics and diversity issues, and then some of the most hardcore basic science stuff that we can always learn from. So it's a pleasure and privilege to be working with you, and I look forward to a lot of great discussions going forward.
Me too. And I especially want to thank our listeners. I picture our listeners often. I know you all don't always agree with us, and there are times when you're impatient with us, but I think that speaking for both of us, we're trying to put ourselves in your shoes and anticipate the kind of guests and information that you would like to hear about. And actually, you on the front line are our real heroes. So we should end this year with our admiration and thanks to you for your role in healthcare. I mean, I think American healthcare has been on the ropes and has come out really fighting and is in no danger of being knocked out. But there are, many more rounds ahead. So I also want to thank our folks at Medscape, our producer Laura, and all our other producers technicians who worked with us, many different folks over time, but Vince and Elizabeth, and it's been a wonderful thing to have accomplished together.
Absolutely, they're a great crew, and they get to be mobilized quickly and turn things around really in lightning speed. Thank you.